Hi all. Are we live streaming? We are? Good to go? Thank you, thank you, thank you. Okay, thank you for joining us once again today for this update on this ever-evolving situation. With the cases of COVID-19 emerging locally, this morning the city initiated its Emergency Operations Center at a Level 2 activation. The activation of the EOC brings key staff together to provide support and resources to manage this emergency. And then I've been in touch with the staff at the EOC and throughout the last couple of days on some important decisions for our residents. This is an ever-changing situation, as you well know. Last night with the school boards closing for 2 weeks beyond the March break, as well as recent travel announcements from the federal government. So we are working to react quickly to changing directions both locally and provincially and nationally. And we'll continue to monitor and respond to these rapidly evolving situations, ensuring that we are providing the best support possible to the community as we work together to find our way through this challenging situation. So we're now going to hear from our lead on the EOC at the moment, Paul Johnson, General Manager of Health and Safe Communities, who will outline some changes that we are announcing today. So Paul.
Thank you, Mr. Mayor, and good afternoon, everyone. Just a bit of a sense, I have a role as a General Manager of the City of Hamilton, but in our Emergency Operations Center, I am the EOC Director. We've brought together today at that Level 2 activation 38 members of our staff who are helping us to manage through the, as the Mayor put it, quickly evolving and ever-changing situation that we're under at the moment. Just to give you a bit of context, the City of Hamilton has not to date activated its Emergency Operations Center to this level. During SARS, there were different levels of activation in some of our natural disasters, such as the ice storm. There were partial activations, but this is the largest scale activation of our Emergency Operations Center since amalgamation. Today, we met at 9 o'clock and we communicated with the Mayor and indicated that we are going to take some steps to curtail the gathering of public in some of our city facilities. And to that end, we've made the decision to implement a phased closure of city programs and events effective starting tomorrow morning until at least the end of the day on April 5th. And you would notice that that matches the 3-week shutdown of the school system. So the first time that we would see some of our city-led and city-run programs begin operation again would be the morning of April the 6th. So what are those types of programs? Those could be recreation activities, and this does include our March break activities at recreation facilities. It would include drop-in centers for parents and children, such as our early on centers. It would include programs that are non-essential in terms of our health delivery, such as prenatal programs and parenting groups. And there will be more that will be listed on our city website. It's important to note that we are not closing city facilities at this time, but we are canceling these city-run program and events. This would also include non-essential and non-statutory public meetings that we would have from time to time, as you might know, here in the City of Hamilton. Those will also be closed until April the 5th. Some community-based activities will continue, and some of those activities do operate in city facilities. And we are continuing to work both with our Special Events Advisory Team, known as SEAT in the City of Hamilton, and with our event organizers and our facility operators to put those situations through the lens that public health has been using around assessing those activities and make some decisions on those in the coming days. So to be clear, this is about city-led and city-run programs in our facilities, and it is not a full closure of our city facilities. We also worked this morning very closely with our Hamilton Public Library partners, and pleased that Paul Takala is here today from the Public Library. They will be very much moving in the same direction, so the Public Library will not be having programs that bring together groups of individuals. However, our public libraries will be open for individuals who wish to come in. The reason that we took these steps this morning, as I say, was to start a phased approach to limiting the opportunities for people to come and gather in groups, small and large. And it is a way of us starting down this path of trying to limit the contact people have with each other. We will continue to monitor situations. Things changed. 24 hours ago, we were in a different position than we are today. Also important to know from the community's perspective, we are not accepting any new group bookings for private event at city facilities at this time. I'm not able to say at this time when we would start taking those bookings, but it's better for us to put a moratorium on new bookings at the moment so we're not having people book and cancel. We're also looking at those current bookings, as I mentioned, and trying to understand whether we should be providing some stronger advice about whether they continue under the current COVID-19 situation. We are trying our very best to make sure that there is a comprehensive list on our city website of all the programs that are affected. But my advice to the public is to assume that if programs are city-run, that they will not be operating as of tomorrow morning, and they will not operate until at the very earliest Monday, April the 6th. We will do our best to keep the website up to date, but we ask for people's patience. There will be, of course, conversations and questions about refunds, and we will fully refund any cost that residents are out or groups are out because of this decision. That will take us a few days. It's not our top priority today to ensure that that happens immediately, but rest assured that we will ensure no one is out financially from this decision. It's also important to know that from a city staff perspective, during this time, if city programs are canceled and our city staff are affected by this, they may be deployed to other work areas, but no employee will be laid off during this time. So this is a redeployment opportunity for us, and we'll continue to monitor the situation with our employees so they are protected from the standpoint of their work within our city. We'll continue to share all of our updates, social media channels, the City of Hamilton Twitter account, and we are now moving into this phase of working very much with community partners around other events that are going on in our city. We have seen a shift in the last 12 to 16 hours in terms of the advice that is being delivered both provincially and federally about gatherings of individuals, and we're going to work very closely with Elizabeth and her team in public health to ensure that we're providing good guidance to events that will bring together large numbers of folks. And as you probably already saw, as we did in the Emergency Operations Center, things like the Around the Bay road race have decided to, I don't think it's a full cancellation. They're considering whether this is a postponement, but it will not occur on March the 29th. So these are the kinds of conversations we're having with our community partners, and we are encouraging community groups and those that work with us to really consider whether they need to have those types of activities or not, and to take very clearly the advice both of our local public health unit, but also the advice that's coming out provincially and federally. I want to conclude by thanking very much all of the folks that are working very hard in our Emergency Operations Center and our parallel Emergency Operations Center that's happening within public health. We do work in concert with Elizabeth and her team and try and make the best decisions that we can. There will be consistent updates as we move forward and as we fully assess some of the other programs and services that may be affected in the days to come.
Thank you very much, Paul. And, you know, we well know that these are difficult circumstances for a lot of people in the community, given March break and what are they going to do with their kids. Unfortunately, these are necessary steps to prevent any additional contact that might continue to spread this unfortunate virus. And so, you know, an opportunity for people to spend more time together or find creative ways of amusing oneself other than the programs that they're accustomed to in terms of the city programs that unfortunately now have been canceled. So we all worry about the impact of a virus, but worry doesn't really get us anywhere. What we need to do is act, and actions are being taken today to ensure that we protect the public and our city staff in the best way possible. So these are uncertain times, and we need to support one another. I would ask residents out there that when you're out shopping for supplies, please only take what you need. There is no indication nationally that there are any shortages. I've had it confirmed that there is no national shortages of toilet paper. Please take what you need and leave some for others, because I think that's going to be a very important issue. There is no need for hoarding, and there's no need to overreact on these issues. Everyone will get what they need, and if you take a reasonable amount. And also, I'd like to express my gratitude to public health and the public health team. They have done a terrific job of providing, I think, good, solid advice, and will continue to do so. And I know that, you know, this is hard work. Everyone's challenged. Everyone's worried. but everyone's doing what they need to do to protect the public, and as well as the EEOC Emergency Operations Center that has been working since Monday and will be meeting and will continue to meet, and may very well add additional recommendations as things evolved over the next coming days. And again, I don't know if the sign is up at the front here, but there's the coronavirus website, the hamilton.ca coronavirus for more information, or Public Health Services, COVID-19 hotline, 905-546-2424, extension 7970, and the Public Health COVID-19 at hamilton.ca hotline. If you want information, those are great places to go. All the information we're providing here and all the advice we're providing here is going to be on those websites, and we'll continue to update you as things evolve. Then we'll, Doctor, there you are. Did you want to add anything in terms of new advice or additional advice you want to share?
Thank you, Mr. Mayor. Just thank you for the opportunity. I think it does continue to be a rapidly evolving situation, and so staying abreast of all the information is very important to do. We did see from the Chief Medical Officer of Health today some updated advice around travel, which might be interesting to those that are watching or that are going to see this in print. So the recommendation is to avoid all non-essential travel outside of Canada. Particularly for those who might decide to go away and with their children when they return, if they are coming back and school is resumed, the children will be asked to be isolated and not go to school or to a daycare when they come back. The suspension of large events is now for those of 250 people and above compared to yesterday, which was at 1,000 people and above. And there have been some significant changes in regards to testing and that sort of thing. So absolutely, if somebody is feeling ill and they want to look for advice, they should go on the websites and take a look at what is happening. If they need to go for assessment, to call ahead so that appropriate isolation procedures can happen. And then they will talk with their health professional about testing. For most people, they will not be tested for COVID unless they fall into some very specific criteria, which can be discussed at that point in time. So just important updates to keep in mind.
Great, thank you. And any questions?
Dr. Richardson, what is the turnaround time for being tested for COVID-19?
So at this point, it's usually about 24 to 48 hours, but we do know that some of them are able to be turned around in hours.
What about any specific measures being taken for medical staff? Because we've heard about medical staff who are waiting, 2 days or more for their results and being quarantined at the same time.
So for people who are tested, it's important to understand as well, if somebody is isolated or is self-monitoring, a negative test early on in that period that we're asking people to quarantine or self-isolate for is not a guarantee that they won't have a positive test later. So that's why we're not recommending to test everybody who's in quarantine or doing monitoring in order to clear them, so to speak. So if somebody is in isolation, they may get tested because they're not feeling well, but in fact, we're asking them to stay in isolation for that full period, regardless of whether that's negative.
And that full period is how long?
14 days.
But when you have doctors in the hospital who have medical staff, like those are very, very important people now. So has there been any discussion about how to maybe get them out of isolation faster?
So those sorts of things, you're absolutely right. The whole issue of balancing risks is a very important one. We do want to prevent this virus from spreading as much as we can, and we want to slow down the spread as well. But at the same time, we do know there are people who are very sick with other things that need to have care, and we need to consider those things. So it's a balance as always. That said, we'll work through any issues, in the particulars that actually happen as to what might be able to happen. You may know that they have made available now, and they're trying to expand things like virtual care. They've expanded codes for billing for physicians so that they can do care over the telephone. So we're looking at all methods of innovation to see what we can do. So assessment centers are certainly in the works. We did have an assessment center during H1N1, so we had a good base to build from, and there's a team who've been looking to put those together, and they're working with the Ontario Health Agency to make decisions about when that might be appropriate to do.
You mentioned a couple of days ago that there was a meeting planned next week with some providers, Good Shepherd, Wesley Ministries, those sorts of groups, about how to identify if someone who's in one of the shelters. And I understand that meeting is the 17th. Is there been any talk about having that sooner, just kind of given the pace that we're going at?
So those issues about how to work with those sorts of populations who are homeless or in shelters, those sorts of things, those are ongoing discussions. We've made arrangements around people who may have difficulty accessing food or that sort of thing to ensure that they have the ability to do that if they're in self-isolation. But those discussions continue, and you're absolutely right. We are moving those forward as quickly as we can.
Question for Paul. You mentioned that, just to clarify, number one, so rec programs are suspended until April, but all of the municipal facilities remain open?
Yes, so it's the city-run programs. So you'll know that our rec centers are used by community organizations. A great example is hockey teams. We don't deliver hockey programming, but others do. In some cases, it may mean that some of these facilities are essentially closed because there will be nothing going on. But what this isn't is a full-scale closure of city facilities. So city-run programs are canceled as of this evening. They won't operate through the weekend, and they won't operate for the next 3 weeks.
So for example, if I wanted to go for a swim, that's out.
Just going to mention that.
Correct. So things like swim lessons where people say, well, there's not that many people. Our goal here is to stop even smaller groups of people from gathering for these types of programs. And we're going to reassess this as it moves along. But we're giving ourselves at least that 3-week break. Rather than doing this on a program-by-program basis, day-by-day basis, we've made this decision to take a bit of a pause here, look at the evidence as we go into next week and the week after, and determine whether this would continue or we would be back in operation in April.
So what happens then to city-owned facilities that are run by contracted partners? Like what happens to the convention center?
So that's the conversation that we are starting. So as I say, this is a phased approach. Today we're announcing the first phase around city-operated programs so that people can be aware, particularly heading into March break because of the significant programming the city runs around March break. But the second conversations we're having are both with users of our facilities who have booked them, not new bookings, but the current bookings. And then the second piece is facilities where there is an operating agreement with a private entity. We're going to have those conversations because the change that Elizabeth talked about in terms of what the advice is on the size of gathering is quite a significant shift. That move from 1,000 to 250 captures a lot more events that are planned in the next few weeks in our community, some of which are being canceled as they go along by the organizers, but we need to follow up with that.
So the events at First Ontario,
They are not covered by this announcement, so these are city-delivered programs only, programs that are delivered in other ways by community groups, nonprofits, or through the work at First Ontario Centre or the Convention Centre. Those at this moment continue unless they've initiated announcements in the last 10 or 15 minutes, and we will be communicating with them about what their plans are and providing advice for those as they move forward.
And is the advice, are you asking them to cancel to the extent that they can, or have you reached that stage?
We haven't reached that stage in the discussion.
Has the city had any issues accessing the hand sanitizer?
So at this stage, one of the conversations we are having is doing a full inventory of our products. You'll know at the city that we have a lot of product across a variety of places. We made the decision at the Emergency Operations Center we're going to centralize that and have a centralized control over all those supplies. So at this stage, we're comfortable with where we're at, but we will know more once we go through that full inventory and begin to centralize that approach to the supply management within our city.
we have a lot of soap and water, I understand.
So at this stage, there's no change to public transit. This is for some of the programs, and as I say, all of the city work that we do is being assessed regularly, and as changes happen and as we look at what's going on with advice federally, provincially, but also what's happening in other municipalities, we make our decisions based on that. It's not always the same. We know other municipalities are taking other decisions, but we'll work through that. But there's no change for how people can move around this city. We also need to realize that a lot of our city-run programs do fall into the category of gathering together some of the populations that A, are a bit more vulnerable, and B, are harder to manage from some of the work that we've been doing with public health. So a lot of our programs are for children, for instance, and that's part of the reason you've seen the school decision that you did provincially. And then the other side is we deliver some of our programs for vulnerable older adults. And again, how do we limit the potential for there to be adverse effects from some of those programs. That's where we're at today. But I would say that to suggest we're not going to be making further announcements, the short answer is we don't know that. We expect that if this continues at the pace of change, there may be further measures. No, the Emergency Operations Center at this point is not recommending that we cancel those types of things, or where there's individual activities that are taking place around city business. So you can still come to City Hall, access our front desk operations, marriage certificates, the important piece of paying your taxes. Those types of things will continue to operate. This is about where people are gathering, that individual activity. And it's the same reason the public libraries have at this stage taken the approach that if you as an individual wish to come in and use the public library, that poses a different risk than if we're running groups, for instance, story time, or bringing together young people to participate in a library program. So that's where we're at today, and we expect that when council meetings start up, that's our position today. The good news is we are also looking at things as when is it important. So today we felt it was important on Friday afternoon before we head into the March break to make some announcements. There are no council meetings scheduled for next week, and then we get into it the following week. So we have some time to assess how those meetings might be different or how they'll progress.
Okay, thank you all very much, and we will update again as necessary or as things evolve, and same time, same place if necessary. Thank you.